Welcome to our Sticky Truth Webisode series. This episode features an in-depth look at dental cement selection. We look forward to sharing 3M's recommendations and insights about dental cementation selection, considering two important factors when making a selection decision. Today we will hear from a member of the 3M team, Dr. Lois Durst, who is our 3M staff dentist. Dr. Lois Durst, DDS, is currently staff dentist for 3M Oral Care Solutions. She earned her undergraduate degree in nursing from the University of Wisconsin-Madison and her DDS from the University of Minnesota, Minneapolis. She joined 3M after more than 30 years of general dentistry experience. She is active in the ADA, MDA, AGD, and was awarded a fellowship and mastership by the Academy of General Dentistry. She also received a fellowship from the American College of Dentists.
My name is Dr. Lois Durst, and I am the staff dentist at 3M in the Oral Care Solutions Division. Over the course of my career, there has never been a time when there has been so many restorative options for crown and bridge. Our choices have gone from gold and PFM crowns to now multiple porcelain and zirconia systems. Along with the materials comes a decision of which cement to use with a particular material. While it's always good to have options, it can be so confusing to know what to use in which situation. Today, I would like to focus our discussion on how to decide which cement to use with a particular restorative material. I think gone are the days of being able to just have one cement in your arsenal. Although there are various patient and clinical factors to always consider when selecting a cement, based upon our discussions with dentists, two factors seem to stand out as the first criteria: the type of restorative material used and the retentiveness of the tooth preparation. There is a difference in the inherent strength of the restorative materials we choose. For example, we know that there is a difference in the strength of a glass ceramic restoration versus a zirconia or PFM restoration. As the material strength decreases, the need to choose a stronger bonded cement increases. On the other hand, zirconia is a very strong material, as you know, and doesn't need strength to come from the cement. In those cases, you can choose a less technique-sensitive cement. The prep design is another critical factor when choosing which cement to use. So, if we have a prep that is lacking in axial height, let's say that would be 4 millimeters tall or less, if it has a lot of taper to the prep, or if it has less retention in general, like an inlay or an onlay, then we would choose a more adherent resin cement. The resin cement also offers the advantage that it is the most aesthetic choice when that is important to your restoration. Realistically, to handle all the different restorative options these days, you probably need 3 different cements at your disposal as a dentist: a resin-modified glass ionomer, a self-adhesive resin cement, and an adhesive resin cement. Here, you can see 3M's lineup of cements in increasing strength. This pink syringe is Reliax Luting Plus cement, 3M's resin-modified glass ionomer. The yellow syringe is Unisem 2, 3M's self-adhering resin cement. And the green syringe is Reliax Ultimate, 3M's resin cement. All have specific properties that make them ideal to use in different situations. For example, while Reliax Luting Plus cement has the easiest cleanup and is the least technique sensitive, that comes at a price, as it is also the least retentive to the tooth preparation. To simplify your selection process, and based upon the criteria we discussed, here are 3M's recommendations as to how to select the right cement for your procedure. Of course, what we have discussed are general guidelines or principles to follow. There are always a number of other factors which play into your cement decision, like the ability to maintain moisture control, the access you have to the area, patient cooperation, of course, or the need for speed or simplicity. I have personally used 3M's family of cements for my whole career in dentistry, and not only did they win me over with their ease of use, But more importantly, the results have lasted the harder test of time. Hopefully you can now understand the major factors to consider to give you the best solution. 3M cements offer all the options you need to use with all of today's restorative materials. Plus, you get the outstanding reputation of 3M's name and the science behind it. So in summary, the less retentive the tooth preparation, the more likely the need for a self-adhesive resin cement or adhesive resin cement. The stronger the dental restorative material used, the less need for a resin cement. Aesthetics, moisture control, access, and patient tolerance are all factors that also need to be considered when choosing a cement. And lastly, 3M offers a complete line of cements to meet all of your clinical crown and bridge needs. This video was intended to help you understand the key criteria in making good cement selection decisions. For further information and additional resources, please visit 3M's Oral Care Solutions website at 3m.com/dental. Thank you so much for your attention today.
3M Oral Care promotes lifelong oral wellness by providing inspired, science-based solutions that help dental professionals achieve greater clinical, professional, and personal success. Named most innovative company in the dental industry worldwide for 10 consecutive years, 3M products support dental professionals and their patients to realize optimal outcomes. Thank you for attending today's event. For even more educational resources, please visit the 3M Healthcare Academy online at 3m.com/dental education.